BRCA1 patient will have a breast cancer risk of 80%.
80%?
In a lifetime, where the lifetime is defined from 0 to 80 years. So BRCA2 will have 60% chance of breast cancer, especially because breast cancer is more common in women. They always
breast cancer men mein bhi hota hai?
Yes, that's why I said that statement. So,
wow, so that's 1%.
So 1% of my patients are men. The youngest person that I have treated, hold yourself, 2.5 years old.
2.5 years old?
Girl. And the cancer was picked by the father who felt a nodule near the nipple. If you follow a healthy diet and if you exercise regularly, the chances of you getting cancer itself is much lower.
Whether you're suffering, not suffering, strength training is so important.
Absolutely.
You know, it's not only nutrition or only strength. It's just working out and eating correctly and, mindfully.
So I met this girl who was 19 years old at that time and was diagnosed with stage 4 breast cancer.
Stage 4 breast cancer.
And all of us knew she was not going to make it. She just asked me, can you do something for me? I said, what do you want? I said, I just want to be able to live for 6 months. I said, why such specific these things? She said, I want to show to my father-in-law that I'm not useless. At the time of menopause, a lot of time women have to be given hormone replacement therapy because they're going through their menopause and they have all these. So hormone replacement therapy given for a longer period of time also increases the risk of breast cancer. So men who have breast cancer, most of them have these mutations, BRCA1 and BRCA2.
Okay.
More commonly BRCA2 than BRCA1.
Welcome to Unstoppable with Rohit Roy, powered by RiteBite Max Protein. Ladies and gentlemen, today we have a guest whose work truly embodies the spirit of resilience, care, and excellence. He's a senior consultant with over 15 years of experience in the medical field and has been at the forefront of breast surgical oncology for over a decade. Trained at the prestigious Tata Memorial Hospital, he's not only a skilled surgeon, but also a mentor to many aspiring doctors. His mission, you ask? To provide comprehensive breast care in an environment that's safe, pleasant and reassuring. आप बहुत लोगों ने हमें मैसेज किए, हमें कॉल किए ये कहने के लिए कि why don't you do more women specific episodes? This is for y'all. Let's welcome the remarkable Dr. Garvit Chitkara. Welcome to the show, sir. So today I am actually very nervous because this is the first, we usually deal with just nutrition or fitness or workouts and today is a super specialized episode. So thank you for firstly coming.
Thank you very much for having me here.
Not at all. It's our pleasure and honor. Let's start from the very beginning. My first question, usually to my guests, so that the audience knows you better, is how did you start? This is super specialized, right? I mean, a lot of people must have thought or advised you, कि अच्छा ये कर लो, इसमें specialization कर लो. How did you decide to become an oncologist?
When I was training for general surgery, which was in Delhi, तो वहाँ पे मेरे जो guide थे, every postgraduate course has a guide where you have to write your thesis.
Correct.
So my guide suggested, actually one fine day he just asked, now you're finishing, what is your next move? I said, I want to do oncology. तो oncology करना है तो सिर्फ एक ही है, you should go to Tata Memorial. Okay. I said, fine, I'll go there. But which oncology do you want to do? I said, sir, let me just first see. So he said, look, one thing you will always have to remember, that the patients that you're going to get are not always going to end up in a successful, they're not going to, so his actual words were, they're not always going to be able to go to Fiji Islands. So I took it with a pill. So I said, you should first go observe there, understand whether you have the stomach for it or no, and then decide whether you want to do this or no.
Okay.
So I did come to Tata Memorial Hospital on a recommendation from him. I stayed there for 4 months, observing various departments.
Observing matlab
not practicing, just looking at other people.
तब तक आपने क्या खत्म किया था सर?
I was a general surgeon, so I could operate. I had the license to operate,
right?
But that was just observation. So after observing in 4 different departments, I honed on to breast, and there was a reason for this. So as when you're observing, you're allowed to see new patients. In the sense, you can just take history and help the other people who are practicing there. To make it go a little faster. So I met this girl who was 19 years old at that time and was diagnosed with stage 4 breast cancer.
Stage 4 breast cancer.
And all of us knew she was not going to make it. And she wanted me to. She thought I was the chief person who was going to treat her, and she just asked me, "Can you do something for me?" I said, "What do you want?" I said, "I just want to be able to live for 6 months." I said, "Why such specific these things?" She said, "I uh, I want to show to my father-in-law that I'm not useless, because he's just shunned me out of the house."
Father-in-law, she was
Yeah.
19,
She was
already
19,
married.
she was married, and she was shunned out by father-in-law, saying that तू बेकार है because तुझे कैंसर हो गया. She lived a healthy 3-4 years, but whatever. That was the negative point of where I thought, boss, really, this my guide was right. I need to have a stomach for this. Next few days, I met a patient who was. It was my birthday that day in Tata.
Do you want to finish the story about this young girl at
So
19?
she lived for 3 years and she passed.
Oh, she did?
Yes. Okay. And this, the second part, the other side of the coin is, it was my birthday and the patient who walked into the OPD was born on my birth date, actual birth date.
Wow.
So in 1983
Right.
is when she was, she was...
On the same day, same
so
year?
I'm sorry, so she was treated on the same day when I was born.
Okay.
She had a 30-year long run, cancer-free, absolutely normal.
Wow.
So, I saw two sides of the coin
spectrum,
at the same place in just 2 days. I decided that there cannot be anything more interesting to do than this. And then I realized, out of my other observers post in different departments, breast was the one which had the happiest outcomes.
Okay.
So I think this was something I had a stomach for.
Also a little bit of destiny, you feel, that you actually saw those two cases back
obviously,
to back.
everything pushes you towards...
Right.
कायनात एक तरफ push करती है.
क्या dialogue कौन सा है वो? कायनात, when the universe conspires, then it shows you direction as well. So that's a fantastic story to start with. Now coming to what we are seeing nowadays, we talk about breast cancer awareness. Of course, people are becoming a lot more aware in the past few years, but it's not enough. Before you came on the show, I was obviously researching you and researching breast cancer awareness. These numbers are only for Bombay, Delhi, maybe Kolkata, Bangalore, the bigger cities. But even till date, that awareness, do you think, is enough to maybe catch the cancer at an early stage? That's my one question. The other question is, what are the myths surrounding breast cancer?
So let's take the first question first. Right. Is awareness enough? Awareness is never enough.
It's never enough.
No matter how much you talk about it, you will still get to see patients who will walk into the OPD and saying, who come to you with a 6 centimeter tumor, and 6 centimeter tumor in a superficial organ, which is right in front of your chest, to be open for examination every single day when you're taking a bath, and you come with a 6 centimeter tumor, which is size of a tennis ball.
Right.
And my question is, how did you not notice it? कैसा हो सकता है कि इतना बड़ा ट्यूमर आपको है और आपको नहीं पता?
वो कभी-कभी होता है और दर्द नहीं होता, ऐसा होता है.
That is the thing. So I was coming to that. So the thing is, every time the answer I get is because इसमें दर्द नहीं था, मुझे लगा नहीं कि ये कैंसर है. So the first thing that I keep telling my patients, or awareness talks, health talks, that the painless lump is the more dangerous one. Okay. For a painful lump, you're anyways going to go to the doctor. Right. You're going to meet a healthcare professional, get yourself checked. But it's the painless one where we decide, and especially because breast cancer is more common in women, they always...
Breast cancer men mein bhi hota hai?
Yes. That's why I said that statement. So,
wow. So that's 1 myth.
So 1% of my patients are men.
I had no idea.
So that's how it is. And so that 6 centimeter thing that I was talking about, every time I have to tell these patients that a painless lump is the more dangerous one. And please do not ignore a painless lump. Please get yourself checked very, very regularly, so that the moment we catch it early, the therapies are less, the life is longer, it's easier to treat, you will be on your business, back to your this thing normally. And because why I was talking about women here is that every time they feel a painless lump, they will always have this thought, अभी मेरे बच्चे का एग्जाम है,
I swear,
अभी मेरे हस्बैंड का कुछ प्रेजेंटेशन है, अभी मेरे को जॉब में ये कुछ करना बाकी है, मैं उसके बाद जाके दिखाती हूँ. then there'll be Ganpati, then there'll be Diwali, there'll be Eid, there'll be Christmas. किसी ना किसी वजह से कोई ना कोई एक्सक्यूज की वजह से प्रोक्रेस्टिनेशन होता है या डिले होता है या अपने आप को हम हेल्थ में सबसे पीछे डाल देते हैं.
You know, I have realized that this is, of course, one point we are talking about, but women in India in general put themselves last, and which is the worst thing because they need to put themselves first.
They are the pillars of the family.
They are the nurturers, they are the caretakers.
They are the pillars of the family. I mean,
and you see this often.
Yeah, I see this very, very often, and it comes from every strata of society. It's not that people who are uneducated or anyways. Absolutely not. It will come from an officer. It may come from a rickshaw puller.
Wow.
Same thing.
So, Doc, another thing I wanted to ask you is that when you say painless lump, what is the percentage of a painless lump being malignant?
So that depends on age.
Okay.
In a younger woman, my suspicion would be, and this is going to be more common, is going to be a benign tumor or a non-cancerous tumor, which is called as a fibroadenoma.
Correct.
Okay. The more you go towards, say, 35, 45, my suspicion is going to be towards another benign tumor, which is phyllodes, but has a tendency to grow into a cancer. 45 to 60, my first suspicion is cancer.
Oh.
Okay. But does that mean that a young person will not get cancer? No. The youngest person that I have treated, hold yourself, 2.5 years old.
2.5 years old?
Girl. And the cancer was picked by the father who felt a nodule near the nipple.
Oh God.
And it was cancer. The patient was from a distant land in India. And I'm not naming because of the...
No, absolutely.
This paper has been published also. That's probably the youngest breast cancer patient in the world.
And you treated her?
Yes.
Did you have...
I operated on her.
You operated her.
Yes.
And if I may ask, how is she doing?
She's absolutely fine.
Absolutely.
So she had a genetic mutation for which we started treating her for. I, with my team and all of us working together in Tata, which had a radiation oncologist, a pediatric surgeon, a breast surgeon, and a medical oncologist, all of us as a team treated.
Since you spoke about genetic mutation, that was one of my questions later, but I'll ask you now, what is this thing about BRCA1, BRCA2?
Perfect.
And why does this have more chances of becoming cancerous?
So from your fraternity, you know Angelina Jolie.
Yes.
So Angelina Jolie, on diagnosis of cancer in her mother, got herself tested for these genes, BRCA1 and BRCA2, BRCA1 or BRCA.
Okay.
So what are these genes? These genes are present in all of us.
Okay.
These genes are supposed to prevent cancer from forming.
Okay.
They are called as anti-cancer gene. And once one of them is mutated, so you get two copies, one from your father and one from the mother. If one of them is mutated familially, it has been mutated for a long period of time, in the sense grandma didn't have, or grandfather didn't have, or then father didn't have, and then you don't have. So in those cases, the chances of cancer coming is much higher as compared to general population. And
much higher?
Yes, where the gene is absent.
Oh, it's
the
absent.
anti-cancer gene is absent or is mutated, is
Right.
not functioning properly. So in those cases, the cancer is chances are much higher. So if I were to put in terms of numbers, say if the general population risk is 2%, the BRCA1 patient will have a breast cancer risk of 80%.
80%?
In a lifetime, where the lifetime is defined from 0 to 80 years. So BRCA2 will have 60% chance of breast cancer, 60% of ovarian cancer in BRCA1, and about 40 to 50% of ovarian cancer in BRCA2. And these are just two genes that we are talking about. There are about 40 genes like this, which now we have tests for.
Right.
And we can do these tests after obviously a session of counseling, and we can find out whether these patients or these healthy subjects carry the risk or not. So what Angelina did, she was a healthy subject. She got these tests done and finally was diagnosed as one of these genes being mutated. And she went ahead and did a prophylactic or a risk-reducing mastectomies, removed both the breast and got them reconstructed.
Oh, wow.
And this is not a story of a distant land. This happens very much in India, very much in Bombay. So Mumbai also has...
So even though she was not...
She was never diagnosed to have cancer.
Right, and she still had a...
She had a surgery because... Imagine if I were to...
So that takes away all chances of her getting...
No, it reduces the chances considerably. It never becomes zero.
Okay.
Okay. But then if I were to live under a fear of 80% cancer in
As
my
opposed
life.
to like,
So men who have breast cancer, most of them have these mutations, BRCA1 and BRCA2.
okay.
More commonly BRCA2 than BRCA1.
Let me veer away from my questions a bit and ask you about, now since I had no idea that even men do get breast cancer. Is it the same way of finding out in a man that it is in a woman?
Absolutely the same way.
So you have a lump somewhere
You have
in your
a
chest and
lump in the, so we call it chest or breast.
right.
They are by the scientists, they call it mammary glands.
Mammary glands, correct.
So
of
mammary
course.
glands are same, except obviously the shape and size is different in women as compared to men because the function is different. But other than that, mammary carcinoma is possible in both these people.
What is the percentage of men having that?
1%. So if I see 100 patients in my OPD, one of them is going to be a man.
Oh, so even that's something that you'd recommend for men to be
At least be aware about it.
aware of
And
what's going on.
especially if you have family members who've had breast or ovarian cancer, get yourself tested for these genes and see if you're carrying these. And if you're carrying these, then you can at least have active surveillance where you're getting yourself checked every 6 months, so that, God forbid, if it comes, you're able to catch it early, and it should not lead to a stage which is stage 4, and then life is at stake.
Right. You know, we keep talking about awareness, early stage onset. You should catch it at the right time so it doesn't become, worse than it is. What are the ways, man or woman? Let's talk about women here because they're 99%, like you said. How do awareness? Of course, we spread awareness. People look at shows like this or speak to you, consult you on their own, like a regular housewife who's got 10 things to do. How does she keep a check, and how does she become aware and use that awareness to say, okay, oh, I am feeling something? What are the various means?
So let me just tell you first by understanding what the symptoms of breast cancer are.
Okay. Please
One,
tell us
we
about
already
that.
said painless lump in the
Right.
breast, in the armpit, or in the neck. Okay, so this could be a sign of breast cancer. Other than
Isn't
that,
this also about cardiac health? These are the kind of pains you get.
no, this is painless lump.
Oh, painless
Not
lumps. Okay.
I am also, so the other, this thing would be nipple discharge.
Okay.
Nipple discharge, especially if it is blood stained, is something that you need to be worried about. You need to come back to go to a doctor, get to a breast surgeon, get yourself.
But that's a
checked.
no-brainer.
Yes. Then there is change in shape or size of the breast, which is commonly seen in cancers which are slow growing, and they tend to retract the nipple inside, and they will tend to dimple the skin of the breast. So dimpling or retraction of the nipple, these are other signs of breast cancer, which can be easily picked up by the patient. Now, how often should you be checking? Should you be checking every day? No. Once in a month, on specific days of your period, you should be doing a self-breast examination. Once a month is enough. Once a year, once you cross the age of 35, you should see a specialist to get yourself checked, and just checking. I'm not even asking you to do a mammogram. Mammogram is the X-ray of the breast. Okay. It's a screening tool to figure out whether you've got cancer, yes or no. So we start doing screening mammograms at 45. Recent publication has reduced that age to 40. So 25, you start doing a monthly self-breast
At
exam.
25?
At 25, you can start. At 35, you start doing a clinical breast examination with a doctor once a year. And at 45, just to remember, 25, 35, 45, start doing screening mammograms.
Okay.
So that's the easiest way of early detection.
Have you ever operated on a man for a breast cancer and he's not survived?
So men tend to do worse with breast cancer as compared to women.
Why is that, sir?
Okay, so I asked this to my teachers when this paper was published, and he had a very clear answer to this, and I completely agree with him. Nature always tries to preserve the gender who bears the weight of making the next progeny.
Right.
We are just contributors to it.
And as a medical professional, you agree with that?
I'm a genetics fanatic. So I've done a lot of courses from Harvard in cancer genomics and genetics.
Right.
So I completely
This is so interesting.
So, but on the more scientific this thing, so there were some mutation genes which showed that cancer progresses differently in men. Even we tend to pick it up later because we think it's a woman's disease. मेरे को तो हो नहीं सकता.
मुझे तो अभी तक नहीं पता था, आपने बताया नहीं, और मुझ जैसे कई लोग हैं,
बहुत सारे लोग हैं जिनको ये नहीं पता होता कि मेल
ब्रेस्ट कैंसर होता है.
And when they have it, because there is no, so when we do the staging, we do the staging based on skin involved हुई है कि नहीं हुई है, muscle पीछे का chest wall involved हुआ है कि नहीं हुआ है, whether it has gone to the lymph node or not. But in men what happens, there is hardly any tissue, so the skin involvement is almost immediate. छोटा सा भी ट्यूमर होगा तो वो उसी टाइम स्किन को पकड़ लेगा, तो स्टेज अप हो गया, एंड स्टेज अप हो गया तो सर्वाइवल पुअर हो गया. So that's why also the men tend to do a little worse because they pick it up late.
Quite sad, yeah. You'll never pick it up early.
But then, yes, that's...
No, but thank you for sharing this, because I think a lot of men watch my podcast and, they will also be aware. But knowing men, the last thing they'll check themselves for is breast cancer.
But so other thing that men should be checking about is testicular cancer.
Correct.
Which is again an organ which is very easily, you can check it. You don't need a test to get this done.
Correct.
But if you feel some lump in the testicle,
there's lots of stigma and myths compared, when you talk about testicular cancer, breast cancer. How do you do away with these myths, and why is there a stigma? I mean, it's just another part of our body. Why is there a stigma?
So
I'm sure you must have met a lot of women who must be coming with families and feeling awkward about discussing it.
Not just awkward about discussing it. Once they know about it, they don't want to tell it outside because they believe घर में शादियां होनी बंद हो जाएंगी.
अरे बाप रे.
तो स्टिग्मा एक अलग लेवल पे है. कैंसर का आज भी
ये सिर्फ इंडिया में है या
मोस्टली इंडिया में? मैंने थोड़ा सा टाइम अपना न्यूयॉर्क में भी बिताया, बट आई डिडंट सी दैट काइंड ऑफ दिस थिंग देयर. बट हियर यस इट इज, बिकॉज वी टेंड टू बिलीव दैट एवरीथिंग इज फाइनली, बड़ों का एक ही काम है, जब वो थोड़े से बच्चे बड़े हो जाए शादी करनी है, और शादी में कोई अड़चन नहीं आनी चाहिए. स्पेशली बिकॉज फीमेल ब्रेस्ट कैंसर, दिस ऑल बिकम्स अ, सो when we are talking about operating on a benign tumor also in a woman, we are always worried, should I be putting a scar on the breast or no?
That's a huge responsibility for you, although it's just aesthetic.
So it's a young girl who's come to me with a tumor which is large. I am very scared to put a scar on the breast because I don't know how it is, even if it doesn't come out to be cancer, which is more likely than not, I don't know how this is going to hamper her personal life later on. But things are improving. It's not as bad anymore.
Right.
People are now, there are people who are marrying breast cancer survivors. And breast cancer survivors, both of them breast cancer survivors, are marrying each other. All that is also happening. So there are good part and bad parts.
But obviously
yes, the stigma exists. The stigma exists.
So let's hope that the stigma reduces in the time to come. How should a husband handle his wife's disease? And two, do you think that there is any, like how we say, okay, you should be aware? Does the husband need to be aware of what he needs to do or how he needs to take care of his wife or spouse?
If you're talking about a person who's already been diagnosed with cancer,
or
if you want to say it like in an intimate moment, if you find a lump, please.
That's the main.
That's like no brainer again.
Have you ever met with a husband who's uncomfortable about it?
About talking about it?
About his wife's
cancer. So very strange.
Especially
a lot of times, people will just, once the person's out from after the consult, the lady is out and the husband walks in, and most of the time when they walk in, they will just walk in to ask ki stage bachegi ki nahi hai, that kind of question. So that's a usual thing. Very, very rarely some people do ask me when they come back and ask, like, can I continue to have a physical relationship with her?
Oh wow.
Because is this going to give me cancer?
No way.
Yes, that has happened, and people do that.
But these are from which?
From, it could be anyone.
Really?
It could be anyone. So stigma is to that level.
Okay. Should a husband do anything differently once his wife is diagnosed? So, physically or emotionally?
No.
Or?
So what you need to do is, so if a lady is diagnosed of cancer in the household, the person who's the caregiving responsibility has to be the spouses, obviously, because he is going to be the only person who will understand her emotionally. He has been with her the longest. He's been with her in the happy times, and obviously it becomes his responsibility to do the other way also. Do not shy away from, so let me just say it out loud, do not shy away from having a physical relationship while she's being treated for cancer.
But that makes it worse for you,
so you please go ahead, and in fact cancer books have chapters on physical relationship during cancer treatment, during chemotherapy. So there are days when the immunity is low. The other days are absolutely fine, and this is need of the body. This is something that you can do, should do if it is, don't shy away from it. And, those questions about whether I will get cancer, absolutely not. It is not a communicable disease. It happens because of certain cells going wrong in your body. It's a produce of your own body. It does not get transferred like this.
I hope this is something that you guys really, really listen to attentively, because this is a huge part of also getting better for the lady.
Yes, absolutely.
And I've realized one thing, Doc, that men in general, I don't know about all over the world, but Indian men in general, if they are put in a situation like that, they easily become the caregivers.
They become, absolutely.
The moment they see their wife suffering, because the wife is the pillar of strength.
Yes.
And suddenly when they see their wife suffering, their entire mindset changes. So I hope that that's true of a majority of India.
So that is, and I see both ends.
Yeah.
I see the ones who would want to walk out of the marriage because there's something like this has happened, and the other people are the ones who would want to just stand up and do whatever is necessary.
Let's talk about one gentleman who stood up and did what was
Lots
necessary.
of them.
Navjotsinghsidhu.
Yes.
So there are a couple of questions about Sidhu Paji I had as far as, because you obviously know his case, which is now pretty much in the public domain. His wife was diagnosed and then it was stage 4, if I'm not wrong.
So the way the explanation came, it was probably T4. T4 in the sense is something which is involving the skin. Does it become stage 4? I'm not sure. I'm not involved in the direct care of the person.
So whatever I do here and whatever, he's always spoken about it, and every time he's spoken about it, it's spoken as stage 4.
Yes.
So let's say stage 4.
Stage 4. Yeah.
Doctors had kind of given up. And when I was listening to his entire conversation, it was quite amazing the way, because he's always been a fighter in his life.
Yes.
He says on record that she's cured through nutrition, diet, and no radiation, no chemotherapy. Okay. Now let's be honest. You are the professional. This is what we've heard, and this is in first person. What are your thoughts on it, and is it possible?
So this had happened just about 2 weeks back when he had this press conference where he said all this. Unfortunately, the part where there has been no chemotherapy or radiotherapy is wrong. She's obviously received chemotherapy and radiotherapy because there was a letter which was, he did say something. So about
May I pause you for a second? The reason I'm asking you this is because we want to send out the correct information out into the public.
So when this came out, the first reaction we had, there are about 250 of us on a group on WhatsApp. All of us are Tata people who've worked in Tata.
And all oncologists?
All oncologists. So we thought that we needed to send out a message. And we did publish a letter, which if you want, I'll share
I would love
also, where we said that the evidence-based medicine remains the pillar for treatment of breast cancer. I do not disagree that nutrition is important. Nutrition is very, very important. But she had chemotherapy, she had radiotherapy, she had surgery, and she had a recurrent surgery because when this was happening, I also went back and heard the interview of the doctor who was treating her, where he said all this, that she's gone through all this. So nutrition obviously played a very important role in her case, but there were other things also. So,
and this is, for a fact.
A fact, because he apologized later. He's also gone out in public and apologized later, saying that this is not what I meant, and I.
He probably meant at the last stage that kind of.
Yes. So I'm very happy that she's doing so well, and I feel glad that a patient who's fought so bravely and is now completely back into her normal whatever.
Is she completely cancer free now?
I don't know the details.
You don't know the details.
I don't know the details of the case, but yes, she seems absolutely fine, and I hope that remains forever. And I would take the better part of this interview and share it with my patients. Is that if you follow a healthy diet, the chances of you getting better are much higher.
Right.
If you follow a healthy diet and if you exercise regularly, the chances of you getting cancer itself is much lower.
Really?
So in our patients, this has been proven beyond doubt that if you are obese and you've been treated for breast cancer, your risk of recurrence is higher. So your risk of recurrence falls if you exercise regularly. And how regularly should you exercise? 40 minutes a day, 5 days a week, and exercise of your choice. So there was a group of us who did some studies in yoga. There's another group of somewhere in US who studied another form of exercise. There's another group in China which has done some other form of exercise. But everyone has said people who exercise regularly tolerate the treatment better, have better chances of survival, and they get back to the quality of life that they enjoy is much better as compared to the people who do not do exercising.
So they fight it better.
Absolutely.
In fact, on our show, I've always kept saying one thing, that come what may, whether you're suffering, not suffering, strength training is so important.
Absolutely.
You know, it's not only nutrition or only strength. It's just working out and eating correctly and, mindfully. So I'm glad that you shared this with us. I've always wondered when I was listening to his, and Sidhu Paji is not the kind of person who say something randomly. So I can assume that maybe he wanted to say that, "Achha bhai, ye sab karne ke baad,"
yes. So,
she was on a very, very good diet, and like you said. So the other thing about nutrition also is lifestyle. Our lifestyle, if you realize, we consume a lot from plastic bottles and things with high lead content and all that. Is it only your insides which decide that you'll get cancer, or the external factors also play a part?
So there are multiple factors which play a part. So say if I were to talk only about breast cancer, because that's my area of expertise.
Only about breast cancer.
So the risk factors which are associated with breast cancer can be divided into modifiable and non-modifiable.
What does that mean?
Modifiable are the ones that you can change.
Okay.
Non-modifiable are the ones which you cannot change.
So that's there in your
That's
body.
there. You can't change anything. So modifiable is central obesity. Most common. Obesity which happens around the trunk.
Okay.
Increases your chances of breast cancer, increases your chances of colon cancer, increases your chance of heart disease, stroke. Something
that's a
smoking. Alcohol intake. Earlier we used to say that moderate amount of alcohol intake is okay, but a recent publication says any amount of alcohol intake increases your risk of breast cancer. Delayed pregnancies. So a lady who has her first child after the age of 30 is at a higher risk of getting breast cancer. But that I don't think is modifiable in today's day and age, because if my daughter is studying and if my partner has studied and made a career for herself, I wouldn't want her getting into this thing if she doesn't want to have a child at that age.
That's not fair too.
So there are other modifiable risk factors that you can work around. Exercise regularly, bring that risk down. Someone who's taken oral contraceptive pills, the pills that you take to prevent pregnancies, for a prolonged period of time, and the definition of prolonged period of time is continuously for more than 2 years, and total for more
2
than 2
years is prolonged.
Yes, and more than 10 years in a lifetime increases your risk of breast cancer. But oral contraceptive pills, they prevent pregnancies. They decrease the risk of ovarian cancer. So I would want to weigh it somewhere. I would want to put it in a place where you take it, but you also use other methods of contraception, so that that benefit is
that's another pressure which is on the woman constantly in a few sections of society, let's say.
So that is something that needs to. But at the time of menopause, a lot of time women have to be given hormone replacement therapy because they're going through their menopause and they have all these. So hormone replacement therapy given for a longer period of time also increases the risk of breast cancer.
Oh, increases?
Yes.
Are you talking about estrogen replacement?
Yes, estrogen replacement. So now the people who prescribe hormone replacement therapy are cognizant of this fact, and they give it in much lower doses, and they give it for shorter periods.
Would you advise estrogen replacement therapy for somebody who's probably nearing the end of menopause?
I would not until unless it's absolutely necessary. If the hot flushes are too bad, if the mood swings are too bad, and vaginal dryness and all this is not really, it's troubling so much that it's affecting your normal lifestyle, I would try to stay away from it. And you will be surprised the number of women who actually take hormone replacement therapy in our country. It's very, very low. Really? They don't take it, probably because of lack of awareness. But a lot of them don't take it because they feel it's a temperate country. The hot flushes, in a colder country, hot flushes are more evident. But in a temperate country, you anyways are.
There's a video of a lady watching a baseball match in America.
And then there's
So I didn't know whether that was real or that was
hot flush. That was hot flush. In a cold country,
there's another. I mean, I'm digressing from what we're going to talk about, but this is something that Indian men have no idea about. Till date, if you go to the slightly more, I won't say backward, but unaware parts of India, they have no clue what perimenopause and what menopause is. And till my, it's a personal thing. Till my wife started going through it, and till she explained to me, okay, I said, Abhi, 5 minutes back you were fine. I said, yes, this is what I'm going through. Please try and understand. And I think most men need to understand that they don't have control over this, right?
And this is associated with mood swings.
Correct, exactly.
The moment you're happy and the next moment you want to slap the other person.
Yeah.
And the problem is that you are the other person.
Yeah, I didn't want to joke about it, thinking you might not want to, but for me, it's like I'm sitting talking normally, and suddenly, just out of the blue, one whiplash comes, and I'm like, "What happened? We were watching a movie. You're just watching a film, and you don't know what triggers, And they start crying, and all of that, and so yeah, that's something that I've seen it happen. And my wife was on the show earlier. We spoke about it. That's something also we need to create.
This
a
is
lot of awareness,
yes,
especially, and also Indian women, they just never complain.
That's the other part. They want, like I said earlier, they put themselves last. So moving from modifiable to non-modifiable risk factors. So non-modifiable risk factors are age. As you age, your risk of breast cancer increases. Yes, but when I say this, I don't say that the younger patients can never have breast. I just told you.
No, please explain to me. Supposing I don't have those mutations of any sorts, and I've been fine till 60. What do you say? How do you mean that it increases the chances of?
So
don't you need to have the cells in your body?
The form of cancer, the formation of cancer is based on DNA repair mechanism. Every day you make 1 billion cells, which are replaced by new billion cells tomorrow. Now, each of these cells is supposed to function, clockwork, do everything what is necessary. And say if one of these cells goes a little rogue, the genes that we were talking about are supposed to tell this cell that, boss,
don't do it.
Either behave or die. So it's called a death signal. No, it's not just BRCA1. So there are about 40 genes, like I said. So BRCA1 also. So in that, if the cell decides, I will not listen to you. So the DNA repair mechanism has gone wrong. And it multiplies at its own whims and fancy, takes up all the nutrition, starts growing faster, and it is not cohesive, so it just doesn't form a tumor. It also breaks away and goes and deposits somewhere else. That is how cancer formation and the spread happens. As basic as I could explain it.
No, this was very well explained.
So as you grow older, this DNA repair mechanism becomes weaker. So the chances of cancer coming in older ages
thus becomes higher. So doc, amongst the many myths that surround cancer of any sort, specifically breast cancer as far as you're concerned, is radiology and chemotherapy. And I want you to be very, very honest about this. I have read and heard so many reports which say it's a big myth. Radiology and chemotherapy.
Radiotherapy, you mean?
Radiotherapy.
Yes.
It's a big myth. It is only going to damage your life, and it is never going to end on a happy note. What are your thoughts, very honestly? And is there any way around?
Okay. So thanks for asking that question, because it's very important. Yes, chemotherapy does affect the cancer cells. I mean, so how chemotherapy works is that it kills all the actively multiplying cells in the body. Actively multiplying cells in a cancer patient's body, the most actively multiplying cell is the cancer cell. Other than that, it's hair, which are growing daily, the nail, which are growing daily. The lining of your esophagus or your intestine is something which is being replaced daily. So obviously these cells get affected. Your bone marrow gets affected. But luckily, the other cells, they bounce back immediately. They don't die permanently. They are replaced, like every day they are being replaced, they're just replaced. And the patient goes back to living a normal life after chemotherapy. But why is it necessary then to give such a toxic medication? Because that's the only medication that worked. So if you go through a book called Emperor of All Maladies by Siddharth Mukherjee, he's given the history of how cancer drugs were invented. And this was first used, a chemotherapeutic drug was used in a child with leukemia. And he saw the magic happen, that the child lived. Okay. So that is why chemotherapy is required. It's something which used to be very, very toxic earlier, but now with the amount of scientific betterment, we are able to produce chemotherapeutic drugs which are much better tolerated.
Okay.
Now you will rarely hear someone dying because of chemotherapy.
chemotherapy.
That does not happen. Not in good
Thank
centers,
you
not
for
in good
clearing
hands.
that up. Yeah.
Radiotherapy works in the same way. It kills the actively multiplying cells, especially it will kill everything that comes in its path.
In its part.
But
So you have to be very careful.
very precise. So you choose machines which are extremely precise and which go on to only those areas which are affecting this. Now you would ask me, is there a way to avoid it? Fortunately for breast cancer, about 60% of patients who are a certain kind, which are hormone responsive tumors, if they come in early at certain age, so say about perimenopausal and postmenopausal women, and if the cancer has not spread from the breast to the node, which is the first station of spread, there are tests available which will tell you whether you have benefit of chemotherapy at all or no. And those tests, with those tests, you can decide not to take chemotherapy at all, and it will be absolutely safe. So, when I say this, people feel that ये तो US में होता होगा, ये UK में, ये यहाँ होता है, हम लोग करते हैं. बहुत सारे पेशेंट्स ऐसे हैं जिनको आज कीमोथेरेपी नहीं लगती, because they have been able to come to us early, they have picked it up early, and they have a absolutely normal long life with just tablets which they are taking with minimal side effects, and they're absolutely okay.
Another myth busted. Before I let you go, I have to ask you a question specifically to breast cancer, or if you'd like to kind of expand. What are the ways a woman can fight this in the early stage of life in terms of lifestyle, nutrition, things that do's and don'ts, so that they kind of say, okay, with age you can't do anything, but otherwise, what lifestyle is best for them to prevent?
So
or delay.
So prevention is one thing that, like I said, those modifiable risk factors. Please do not smoke.
Correct.
Do not use
drink
alcohol. If possible, have a child before 30 years of age. Breastfeed adequately. Adequate breastfeeding means at least for 2 years in a lifetime.
Right.
So that's one of this thing. Otherwise, try and be as stress-free as possible. I don't know if that is really possible, but
that
yes,
in today's day and age,
exercise regularly. Watch what you're eating. If it is, we tend to follow a lot of diets where we want something to be imported from somewhere and it is put on our plate and we are very happy about it. But the local produce is always best.
Yes, absolutely.
So something that your local farmer, your greengrocer is bringing you is much more healthier than any exotic vegetable. That
every time I ask my wife, I want to have Atlantic salmon. She said, why can't you have the salmon which we get?
Yes. So that is the difference, because that particular food item which has been shipped from there is obviously going to have some amount of pesticides or preservatives for it to remain fresh till it reaches your table. The more distance that it travels, the more exotic the food is, the more poisonous it is going to be when it lands on your table. So it's much better that you take something which is natural, which is there. Stress-free, I will just say once again, please be as stress-free as possible.
As much as possible.
Take as many vacations as you can, as much as this thing allows, and try and really, really watch what you eat, especially the timings on what you eat. So as a working person, it's very easy for us to miss the breakfast, have a lunch which we have carried in a dabba at the office, and then finally have a dinner, because that is the time when the whole family is together, which is a 4-course, 5-course meal where you have a starter also, or a plate of salad and everything. But you have to reverse that. You can have a heavier breakfast, have a light lunch, and have a dinner like you don't have money to buy it. So breakfast like a king and supper like a pauper. That's how
you still stick to that?
I try to as much as possible, but I just told you I started my day at 5 today.
Right.
And I
was just going to mention it that he's already had 2 surgeries and he's come here. And his day started at 5 a.m. and you look fresh. You don't drink and smoke, obviously.
No, I don't.
Okay. Before we let you go, the final thing, we have a fun segment. Abhi, inko kya पूछने को बोलूं? We have a segment called the Ask Rohit segment. Okay. I doubt you don't know anything about anything. So you can go ahead and shoot me a question that you want to. Okay. It could be anything. Please don't ask me about cancer. I've just learned.
So, Let me ask you something. When you guys work out,
Right.
not just work out.
Workout.
How much pressure is it to what drives you to go to the gym every day or whatever sporting activity?
Right.
Because this could be helpful for a lot of us.
Right.
Like I want to go to the gym every day, but I
Right,
cannot.
you cannot.
And on the day when I have time, I've still got that inertia. What drives you guys? Like especially when you're in front of the camera, you know that this is something that is going to. This is what my work is. So what drives you?
So my personal answer would be, of course, at one level, it's the aesthetics. I want to be in front of camera when I wake up in the morning and look into a mirror. We are constantly looking into the mirror. I want to look a certain way that increases your confidence. And you don't have to be an actor for that. Anybody, we are all selling something in this world.
Yes.
You're obviously specialized at something. You don't need to, but everybody else is a salesman in this world. So you need good aesthetics. Like somebody who's selling a pair of jeans who walks into somebody's office and there's somebody else also along with him who's a competitor. If you're well turned down and you look good, your confidence is on a high, you'll sell it better. So that's one thing which our job obviously requires the most. But I go to the gym and I play a sport because I enjoy it. I think the endorphins which flow post a workout session or post a game of pickleball, for instance, which I've just taken up this year, 3 months back, they make me really happy. I come back tired, I sleep well, and overall it kind of takes care of my health. Strength training for me is very, very important, not only for the way I look, but I feel good about it.
Super.
And pickleball takes care of my cardiac health, which is also, I feel flushed after that, but like I said, I sleep well.
Super.
So for me, personal reasons are those.
Phenomenal. So basically, I need to understand, I need to get invested in a sport which drives me towards it every
You will
single
love pickleball. I can give you this. You've given me so much gyan today. I'm giving you one piece of gyan. Get onto pickleball. It's a sport where you will expend the right kind of energy, even though you've done 3 surgeries, 4 surgeries, and you love it. It's also about bonding. You're playing with your friends, maybe at a club, maybe. And it is also the widest played sport in the US right now.
So I have a busted ACL. Will I still be?
No, it doesn't matter.
Oh, super.
I have a busted knee and an ankle, which so many years of doing, when we used to do action back in the day, 20 years back, we didn't fall on airbags. We used to fall on gaddas. And so my rotator cuff is gone, constantly falling on one hand. But this is something that you'll easily be able to do.
Super.
So don't obviously try singles, play doubles. That's what we play. Okay, so thank you for being here, Doc. And it's been very, very informative for me. A lot of my friends are going through this. We spoke about it. Hina is an actor who's been going through this. And I hope that this kind of helps people with and without cancer moving ahead in life. Any keep going mantra, we have a segment called the RiteBite, keep going mantra. आपका कोई मंत्रा रहा है लाइफ में, कभी आपने कोई ऐसा मौका आया जब बोले यार अब ये नहीं हो रहा है, because you don't look like you're too thick skinned and all of that, and you obviously had those 2 very good stories back to back early in the day. But anything that you've ever felt that, okay, this is what keeps me going, or anything else you'd like to tell our audience?
So for me, the gratification comes from the work that I do. It's the easiest. So
oh, lovely.
So when the patient is treated, cured, and walks into your OPD, and I get the dose of that every day, because there'll be an OPD is always mixed bag of patients. You will get some new ones. You'll have those sessions where you'll have to sit with them, hold their hands while they cry and all that. But there'll be ones who finish their treatment and walk in, and they will, no matter how much you tell them, will walk in with a box of sweets or a chocolate or something, saying that, I owe this to you.
That's the best validation for a doctor.
And the moment you get up from that sort of a consult, you are on top of the world. That keeps you going every single day. That keeps me going every single day, because that's the gratification that you're looking for, and that's the thing that keeps you going back to work every next
It's like
morning.
an actor delivering a good scene and feeling happy about it. Thank you so much for being on the show. And I'm going to have a long chat with you after the show.
Thank you.
And you guys, I mean, what can I say? This has probably been one of my best episodes where I've learned a lot. And I hope that you have too. Keep watching Unstoppable. Be healthy, be safe, and be happy. Lots of love. See you soon.